We're going to begin with the latest on the coronavirus crisis, with the U.S. bracing for a potential double surge of cases this winter. ICU beds are starting to fill up again as the Omicron and Delta variant spread nationwide. Health officials have urged all eligible Americans to get vaccinated and to get their booster as family and friends start gathering for Christmas, New Year's, and other major holidays. Courtney Kealy is joining us now with more on this. Courtney, good morning.
Good morning, Anne-Marie. The Omicron variant is spreading quickly, and while unvaccinated people remain most at risk, vaccinated people could still get breakthrough infections as well.
The bells of the National Cathedral in Washington rang last night, marking this week's grim milestone: 800,000 coronavirus-related deaths in the U.S. Hospital staff, already stretched thin from the Delta variant, are bracing for more cases due to Omicron.
At this point, there is no need for a variant-specific booster. And so the message remains clear. If you are unvaccinated, get vaccinated.
At least 36 states and 76 countries have confirmed cases of the Omicron variant. The vast majority of COVID cases, about 98%, are still the Delta strain. But in states like New Jersey and New York, rising Omicron cases are about 13% of all cases.
We expect to see the proportion of Omicron cases here in the United States continue to grow in the coming weeks.
In south central Wisconsin, there are more patients hospitalized with COVID-19 than in any other time in 2021. At this hospital, all the ICU beds are full, as well as rooms for less severe cases.
This is the only empty room we have today, yep.
As Omicron cases spread, some colleges and universities are going remote. Among them, Cornell, which had an outbreak of about 1,100 cases, despite most of its students being fully vaccinated. Princeton students will take their exams online and are being urged to head home for the holidays as soon as possible.
And it's this worst case scenario, this triple threat surge, that experts say they might be seeing as early as January, with Omicron cases and the onslaught of Delta variant combined with peak flu season that has everyone worried.
Yeah, and then meantime, there are some questions about the Johnson & Johnson COVID vaccine. CDC advisors are going to be meeting today, and they're going to be talking about possible limits on the vaccine. What can you tell us about this?
Well, the single-dose vaccine can still cause rare and severe blood clots, mostly among young and middle-aged women between the ages of 30 and 49 years old. We saw that 10-day halt of administering the vaccine last spring, and now a review found 6 deaths among 50 cases from this issue between last December and August 31st. During the same period, at least 14 million people were administered that single dose. And the advisory committee today on immunization practices will be presented with the new data, and then we'll see what they'll have to say.
So we're hearing, across the country about all sorts of sort of COVID restrictions being put back in place, limitations when it comes to indoor behavior, and schools, being very concerned. So with that in mind, anything more on whether or not children may need to receive, a booster maybe?
Well, Dr. Fauci also spoke about this yesterday. Now, when he said he would have been really, really worried if there hadn't been the vaccines available already and there was nothing specific to these 2 variants, he said that children have a much more robust immune response than adults, which is good news. And he said he did not rule out whether boosters may eventually be needed for children, but at this point, they are not advising boosters for children.
All right, Courtney, thank you so much.